Your teenage child has been struggling with functional neurological disorders, short for FND. Well, how much is it costing you and your child, and what can you do about it? Hi, my name is Dr. Lee. I'm a pediatric health psychologist and chronic pain survivor myself. My mission is to help teens and their parents, like you guys, to resolve persistent physical symptoms such as chronic pain and FND so that they can get their life back and feel like normal again, because I truly believe these teens who are struggling with chronic pain and FND deserve so much more in their lives. I have seen so many patients and the families who are struggling with these conditions and successfully resolved all of these symptoms. Therefore, I am a true believer that these symptoms can be resolved. The great news is, if this is happening for your child and or your teenage child, then chances are for your child to resolve these symptoms are much, much higher compared to waiting for a few more years or decades until your child becomes an adult, which becomes a little bit more difficult to resolve these symptoms. So today's video is all about, well, how much is FND costing you and your child, and what can you do about it? So I found this article talking about the worldwide study of exactly how much FND is costing you as a family unit and also economics. And the result was pretty astonishing. So I want to share that. I mean, just cut to the chase. The overall cost of FND per patient per year varies between as low as $5,000 all the way up to $87,000 US dollars per patient per year. And specific to pediatric populations, well, there are not that many studies looking for pediatric populations, but I found some, and so did I. And based on the study, for pediatric FND, that includes teen FND, is costing anywhere between $5,000 to almost $30,000 per patient per year. So imagine if you have two kids who are struggling with FND, and guess what? Then it's going to cost double. So anywhere between $10,000 to $60,000 per family per year if you have two kids with FND. And these costs are divided into direct and indirect. Direct costs includes things like doctor's visit, like 10,000 of them, right? And then any tests or investigations that you would be going through to get to the diagnosis, and numerous ER visits. And this study also found that even though patients are getting FND diagnosis, they continue to go to ER for their symptom flare-ups for whatever reasons. And then the indirect part is, let's say, any missed days from work, school, and just life, and emotional cost and missed opportunities and quality of life and all of that stuff are into the indirect category. So between the two, it's costing a lot. And it is just as much of expensive, if not more expensive, than other neurological disorders such as epilepsy and multiple sclerosis. How crazy is that? Then it got me thinking, so what the heck is going on here? And then what is the bottleneck? Why is FND costing this much money for each family and economy? Well, the biggest bottleneck is, well, you guessed it, it's inaccurate or unclear diagnosis of FND. And therefore, statistically speaking, many patients continue to struggle for several years until they get to this diagnosis of FND, which is so mind-boggling. But it actually is true, because I have been talking to so many families these days. By the way, thank you so much for those who have been contacting me for consultation. I really appreciate that. All over the world. And the majority of the families that I talk to, they don't even get to the diagnosis of FND, even though they, as a parent, have suspicions, total sus. They are wondering if their child actually has FND. So this is really mind-boggling and heartbreaking, because parents seem to be a lot more informed about FND than a lot of doctors, which is crazy. But this is why I created this channel, because I want to empower you so then you are more informed about FND than anybody else on the planet. All right, so back to the biggest bottleneck, which is the inaccurate diagnosis of FND. So I created a list of what you can do to prepare for doctor's visit. So hopefully you don't have to waste your time and money and energy and more money on ineffective investigations or potentially wrong kinds of treatment for your child. So let's get to it. Let's make a list of potential symptoms that you are noticing for your child, and B, be prepared for any possible scenarios that includes any investigations. Okay, so in terms of the symptoms, I'm going to give you general categories, but then there's a checklist so you can just check off whatever you feel like that's applicable for your child, okay? First of all, they're generally speaking seizures category, movement category, and other category, okay? So for seizures category, I put seizure-like symptoms, loss of consciousness or syncope, aka fainting, memory loss, brain fog, poor attention, dissociation, and confusion. The movement-related category includes tremors, twitches, numbness, weakness, paralysis, jerking, muscle contraction, abnormal postures, balance and walking problem, muscle spasms, muscle stiffness, and tics and Tourette's-like symptoms. And then the other category includes speech difficulties, vision loss, hearing loss, pain, including chronic migraines, fatigue, extreme slowness of the thinking, numbness to touch, loss of smell, and behavior regression, like your child is acting like a toddler or much younger age when your child's actual age is much older. So those are the broad categories of the list. Again, I do have a checklist, so make sure to download that so you don't have to remember and then write those things down when I'm talking about this, okay? And then make sure to bring that list to your doctor's appointment. And here are possible investigations that your doctors can do to get to the diagnosis of FND. One caveat is, unfortunately, as of today, there isn't any one single thing that doctor can do to make a diagnosis of FND. So it's going to be a concoction or combination of different things. So check this out. Physical exam, medical exam, blood work, clinical interview, and history taking, any medications or supplements that your child has been taking or did take. And then there's a bunch of scans. CT scans are for head injuries like bleeding and bruising, stroke, brain tumors, and other brain diseases. So mostly doctors are doing CT scan to sort of rule out that these things are not there. And then there's MRI, which is a brain picture and surrounding the nerve tissues. And then there's the EMG, checking the activities of the muscle and the tissues. And then there's the EEG or video EEG, VEEG. They're both checking the electrical activity in the brain. OMG, so there are so many tests and scans and all the kind of things that doctors can do. And you as a parent have a right to ask your child's doctor to consider these tests or ask them if they're not doing, why not? Okay, because you do have a right to ask why they're not doing these tests. Could be capacity, it could be they don't believe it, it could be they're not familiar with the FND. If that's the case, you can definitely ask them, hey, are you familiar with FND? You can absolutely share the checklist that includes all the testing and investigation options with your doctor if you want to. Once again, I have all the things that written down in the checklist, and you can absolutely bring that. And then your child might be experiencing something different other than what was listed on the checklist, because it's not even an exhaustive list, but I just listed what are typically experienced amongst patients with FND. So there is a space for you to write them down along with what your child is basically telling you or complaining about. So once you get to the diagnosis of FND, then you as a parent and your child are going into the journey of figuring out what it is and how to resolve it. And I have tons of videos talking about what FND is and potential influencing factors, and then how you as a parent and the teens can manage the symptoms, if not resolve the symptoms. Ideally, if you can find a specialist with FND in your area or anywhere else, that would be a golden. But unfortunately, there are not that many of us that are out there. That's why I created this channel, to provide as much information as possible that are readily available at your fingertip. So I don't know about you, but this cost of FND per patient per year is really mind-boggling, and it kind of bothers me because why? The bottleneck is the inaccurate diagnosis. Yes, there isn't any one single diagnosis or diagnostic tool that anyone can use to get to the diagnosis of FND. However, there are ways to help your child. And I really hope that you can take this checklist and educate yourself better about what might be going on with your child. Also, speaking of the checklist, I also have a free PDF parenting guide on how to help your child at home who is struggling with either chronic pain or FND. So make sure to click the link below and get the guide today. Well, thank you so much for watching this video, and I will see you in the next video.